Welcome to Bridging the Gap, a short video series where we're talking about value-focused care delivery for specialists. I'm Sally Engelman, Vice President of Growth at BridgepointMD. Today, we'll be talking about engaging patients between visits with our co-founder and participating otolaryngologist, Dr. Will Harrill. Dr. Harrill, why would engaging a patient beyond the office be important for the specialist and the patient?
Well, Sally, that's a great question because making sure you're in contact with the patient once you've had your face-to-face visit and a care plan's been put in place, that the patient is actually either complying or, more importantly, able to comply with that care plan. No plan is going to be effective if they're only doing parts of it. So that's really the whole purpose of having contact points outside of the practice that extend the physician and the APP's role in patient care, as well as the rest of the care team. You're empowering your care team to make sure that what you've put in place is actually happening within that patient's care cycle.
That makes a lot of sense. And how does this impact patient care and quality?
Well, for one thing, it maximizes quality because when you have a patient, just for an example, a surgeon sees a patient, puts in forth a care plan that the patient's going to go into the operating room. You see they have hypertension, maybe their blood pressure is a little bit high during that meeting. And the patient blames the white coat syndrome. All right, so their blood pressure is a little bit high. Well, how do you know they're really taking the medicine? They say they are, but now we're getting closer to surgery. Or even if you look at blood thinners, the patient's supposed to stop those 72 hours before the surgery. Don't assume anything. Just like a pilot about to fly a plane, who is doing the safety check between the office visit and either the next office visit where you're assessing the effectiveness of your care or in the next higher risk encounter, which would be in the operating room setting. And all of that checklist needs to be done on a separate date at a separate time where the patient is going back through what they're doing in terms of compliance with the care plan.
Thank you, Dr. Harrell. If you'd like to learn more about engaging your patients, please comment "engage" on this video and we'll reach out to you with more information. Thank you.